Dr. Peter Hotez and Dr. Maria Elena Bottazzi have dedicated their careers to studying epidemiology in the underdeveloped world. They've recently earned international acclaim for their efforts in developing a patent-free vaccination for the COVID-19 virus. This vaccine, called Corbevax, was developed at the Texas Children's Hospital Center for Vaccine Development at Baylor College of Medicine. It is now being manufactured and will be distributed in a number of countries, including India, Bangladesh, South Africa, and most recently, Botswana. It is work that has garnered widespread praise for the doctors and their team, praise that includes a nomination for the Nobel Peace Prize.
Despite the fact they received little encouragement and even less funding from our federal government, Doctors Hotez and Bottazzi persevered. They decided not to patent the formula for their vaccine and have encouraged all nations to use their technology for the public good, just as Dr. Jonas Salk did during the polio vaccine some 70 years ago.
As Dr. Hotez has stated, the coronavirus is constantly mutating. Though we have now seen several variants of the virus surge and ebb, there may well be, and there probably will be, more variants developing among unvaccinated populations elsewhere in the world. That's why it's critical that Corbevax, which is relatively inexpensive and easy to manufacture and distribute, is now available.
We are all connected. Vaccinations amongst traditionally underserved populations will not only help those who are vaccinated avoid the pain and suffering in their own lives, they will also help us here, because the vaccinations reduce the possibility of a new variant developing amongst those populations and spreading internationally. So, by developing the Corbevax vaccine, Doctors Hotez and Bottazzi are helping us serve and protect our patient population, and indeed, the entire community here in Central Texas.
In 2020, when the coronavirus outbreak started, we already knew exactly what to do in the lab. Our specialty has always been recombinant protein vaccines, and we created this vaccine center with the hope that indeed we could hand over a technology to the countries that have the greatest need. And to be honest, in 3 months, we were able to create a prototype of a COVID-19 vaccine, which now is going to be deployed in billions of doses around the world.
But what's great about our vaccine is it's a technology that's been around for 4 decades. So we know what's going to happen with this recombinant protein vaccine. It's completed now all of the clinical trials, phase 1, phase 2, phase 3, very exciting results. And now it's been released for emergency use listing in India. The game changer for what we're doing at Texas Children's is, in that spirit of Texas, we're actually making vaccines. We're making the vaccines that no one else will make, because if we can't make it at low cost and widespread accessibility with simple storage conditions, we're not going to make it at all. And that's a very unique type of approach.
It doesn't stop there. They're already doing clinical trials to evaluate the vaccine in the pediatric population, extending the accessibility and the reach of our Texas Children's vaccine, because we can really contribute to really bridge this gap and really squash the virus all over the world.
Now we'd like to hand it off to our leader, Regina Rogoff, for a very special presentation.
The W. Neal Kocurek Health Advocacy Award recognizes people who have distinguished themselves through their efforts to improve the health of our community. Mr. Kocurek, co-founder and executive at Radian International, is remembered as a brilliant leader and a consummate civil volunteer. He touched countless lives through his efforts in public and higher education, transportation, water, social equity, community development, and healthcare. He was especially proud of his work as CEO of the St. David's Partnership, where he imbued 6 partnered hospitals with a charitable mission, resulting in over $100 million in uncompensated care. He was also a great friend of People's Community Clinic and our work to make healthcare more accessible to our uninsured and underserved neighbors. I am confident that if Neal was here with us today, he would be thrilled by our Kocurek Health Advocacy Award honorees, Dr. Peter Hotez and Dr. Maria Elena Bottazzi. I can't imagine two people more worthy of this award. These two scientists, innovators, and philanthropists have developed a COVID-19 vaccine during the worst possible pandemic in U.S. history. And by using traditional vaccine technology and making it patent-free, they have ensured it is widely accessible throughout the world, which will help vaccinate nations with fewer financial resources. Your remarkable work not only improves health locally or even nationally, but globally. You are certainly deserving of this award. We are honored to have you with us today to accept, and it is my great privilege to present you with the People's Community Clinic 2022 W. Neal Kocurek Health Advocacy Award.
Thank you very much. Thank you.
Thank you both.
Thank you. That's very kind.
Well, and you certainly are our health heroes.
Thank you. Thank you.
Regina, thank you very much for your very kind remarks. What a privilege and honor it is for me to receive this Neal Kocurek Award for Health Advocacy along with Peter. The People's Community Clinic, with its leaders and staff, really exemplify the strengths and the true meaning of servant leadership. As a servant leader, you and your staff see the opportunity to serve others, listen, share knowledge, to empower others, and measure success with growth and development of our communities. Hence, your vision and mission to improve the health of medically underserved and uninsured Texans is really an inspiration for us to be more transformational. So thank you. We have always wanted to understand how poverty could be explained and reduced. And we do know that poor health caused by many infectious diseases can really have an effect on poverty, but also can exacerbate poverty. So in Texas, for example, the official poverty rate is more than 13%, more than 4 million people. And it's really significantly worse than the national average, as well as now we know that the pandemic probably increased that. With Peter and our team of scientists, we came to Texas to learn, to research, to educate, to raise awareness about preventable infectious tropical and emerging diseases. Diseases that are caused by parasites like Chagas disease, leishmaniasis, intestinal infections, cysticercosis, toxocariasis, many others, many that a lot of people don't even really know what they are. But they're all diseases that afflict poor people. That is why our scientists create and make vaccines against many of these diseases. We transfer our knowledge and the vaccines with a philosophy that ensures open science, the removal of barriers, and with transparent communications to help incentivize, build, and strengthen the capacity of vaccine development locally and with foreign nations. In doing so, we really guide and influence policy and advocacy through what we call vaccine diplomacy. So we hope that our story really exemplifies how the importance of intersection of science and technology with diplomacy, engagement, and service really strongly believe that can be an accelerator and a game changer to achieve equity in health. And that's what we love to do. And so we currently are very thankful for the more than 50 years of service that your community is receiving with very high quality, affordable healthcare, dignity, and respect. You're helping the community really ensures the progress of the population living in Austin and in Texas, reducing poverty and social inequality. As highlighted by the author Peter Block, communities are the structure of belonging. The W. Neal Kocurek Health Advocacy Award recognizes people who have distinguished themselves through their efforts to improve the health of our community. Thank you very much.
Well, thank you so much, Regina, and the People's Community Clinic. And thank you, Mary Elena, for your eloquent comments. Indeed, we came to Texas 11 years ago with this idea of building here a National School of Tropical Medicine. And while they're officially called tropical diseases, they're overwhelmingly diseases of the poor. Poverty is the overwhelming determinant of neglected tropical diseases for a lot of reasons we can go into. There is also the effects of climate change, and Texas, of course, is disproportionately affected by climate change and urbanization and human migrations, but poverty is the king of all drivers. And so we share that commitment to health equity and addressing these poverty-related neglected diseases. The irony is about 10 years ago, we also started doing coronavirus vaccines because they were orphaned just like the vaccines for diseases, as Mary Elena points out, Chagas disease and schistosomiasis. So we started doing that using the same approach where you can develop those vaccines locally in low and middle income countries. And we're able to turn that around very quickly for a COVID-19 vaccine that's now reached 30 million adolescents in India. And hopefully that's just the beginning. I think the other piece of this that we have to recognize in this time of COVID is that it's not only promoting vaccine science, but combating the anti-science. Unfortunately, Texas has become the epicenter of the anti-vaccine movement in the United States. And it's a killer. During this Delta wave last year, I now calculate that roughly 200,000 unvaccinated Americans needlessly lost their lives because they were defiant of getting vaccinated. I look forward to working with you in People's Community Clinic, not only on addressing health inequalities and vaccine inequity, but combating this terrible anti-science movement, because it's now become as an important part of health advocacy as well. So we're so thrilled to be recognized by the People's Community Clinic, and so grateful for all of the great work that you're doing and your service. Thank you.
Thank you both so very much.